You're listening to the Black Excellence Podcast, untold stories of passion, persistence, and perseverance. Brought to you by Black Health Wealth.
So what's the importance of actually having Black doctors? And, how do we get more?
Yeah. Oh, man, that is elephant in the room, right? We need more Black doctors. We need more doctors in general, right? I got to just say that first. So anybody who's listening to this, who is interested, please contact me so we could walk through the steps, because I think that is fundamentally important that we just have more doctors. It's even more important that we have more Black doctors, because the studies say, especially in the field of cardiology, that Black patients who have Black doctors are more likely to be compliant when it comes to taking their medication. And so that is just one nugget of many nuggets, right? They're also more likely to return for a second visit. They're more likely to follow the instruction of the doctor when it comes to diet change, so on and so forth. And that's not necessarily just specific to Black people. The Latinx community, it's the same. The South Asian community is the same. People who look like you are able to get better outcomes for their patients because the compliance rate shoots up when they're talking to someone like them. And so, and for me, and that's what the studies say. For me, on a personal level, I think that there's a level of stress relief that comes when I'm talking to somebody. The minute I walk into a doctor's office, if I see another Black person there, or I see another person of color, my stress goes way down. There's a phenomenon called white coat hypertension, right? It's like your hypertension spikes up, your blood pressure spikes up when you're at the doctor's office. I gotta tell you, I never experienced that phenomena when I see a person of color there. I have to wonder to myself why that is. So there's, on a personal level, there's just a level of comfort that is there. In terms of increasing, honestly, to go to medical school and to take this academic route, I gotta tell you, it's expensive. You're always fighting for scholarships and different things. Many of our parents, because of the racial wealth gap, they can't afford to just pay for all this schooling, right? So I definitely think that it's incumbent on the federal government to provide more money to residency programs and medical schools that are specifically tailored towards increasing the recruitment and retention rate of African-American people. I think that it starts there. And then I think the second thing is, as a society, we laud entertainers and celebrities and athletes, but we don't necessarily laud people who are in the science, technology, education, and math fields, or the engineering fields, STEM. So I think that we have to glorify those fields a little bit more than we do. I'm a public health doctor. I was the only African-American male in my graduating class at Harvard this year. That's an atrocity. I think it's very important for us to publicize these career paths as career paths where people can make a living, and not just a living 5, 6, 7, 10 years down the line after we've paid off loans, but they can actually make an immediate impact on their community while making a reasonable living within, within not just the health, but also the public health field as well.
This is the Black Excellence Podcast. Get ready for Black Excellence.